Hello and welcome to another installment in our 5-part webinar series presented to you by APHSA in partnership with the Maryland Department of Disabilities. This series will share cutting-edge innovations that demonstrate how services across the country can much more effectively assist young people with disabilities aged 14 through 24 and their families to successfully transition out of K-12 education into post-secondary education or work. These families interact not only with disability services, but also with our human services and supports, and the innovations to be discussed emerge from a 5-year federally funded model demonstration project called PROMISE. The innovations speak directly to how our agencies can better align and coordinate with other systems to truly improve outcomes for these young people, who are most at risk to face a lifetime of dependency on public benefits. The work of the PROMISE Model Demonstration Project produced significant learnings that are highly relevant to all those who work at the intersection of the many sectors and systems addressing issues of disability, economic and social mobility, education, public health and well-being, and children, youth, and families. The lessons learned are also highly relevant to other whole family frameworks you're probably already using, including two-generation and whole family approaches. Since early 2019, APHSA has been partnering with the Maryland Department of Disabilities and the leaders of the 5 other PROMISE projects. We've partnered to engage human service professionals and share approaches and lessons learned from PROMISE and ways to help you explore how to apply these lessons in order to more efficiently and effectively serve people with disabilities, including those with non-obvious disabilities, within the populations that you serve. This webinar series captures the depth of learning and expertise from across the PROMISE sites and is organized into important topical areas. Each webinar will also provide a number of tools and resources to help you move the needle in your jurisdiction. We encourage you to watch the whole series and to share it with partners across other sectors and settings. Today's presenters are Jade Gingrich and Carol Riddell. Jade Ann Gingrich has over 2 decades of experience in state policymaking, starting as Executive Director of the Governor's Committee on Employment of People with Disabilities, and most recently as Director of Employment Policy for the Maryland Department of Disabilities, the nation's only cabinet-level cross-disability department. And Carol is currently the Administrator of Crisis and Suicide Prevention Programs for the state of Utah. Prior to this, she was the Project Director of Aspire. And with that, I'm going to hand it over to Jade.
Thank you, Christina, and welcome. It is indeed an honor to be a part of this important webinar series. There are 5 webinars in total, and our topics include an overview, a session on education and family engagement, a session on disclosure and non-obvious disabilities, and a session on customized employment, overcoming barriers to work and work-based learning. Key elements of these series are the webinars themselves, tools and templates, some of which can be modified for use in your state, resources, as well as questions and answers for guiding discussion with you and your team. The recommended approach is that you convene a team of state or locals comprised of representatives of human service agencies and disability agencies, such as vocational rehabilitation and workforce development, such as labor. This is an opportunity not to create a separate process, but rather to integrate some of the lessons learned from PROMISE into other efforts and planning that your state may have undertaken, such as 2Gen, TANF, and others. The link to the supporting materials will be available at www.mdtransition.org, and we will also have a link to the materials at the APHSA site. For way of introduction, PROMISE was a large-scale national research grant with over 13,000 youth on SSI and their families recruited to improve their educational and employment outcomes. Sites across the state included California, Maryland, Arkansas, Wisconsin, Aspire, led by my co-presenter, Carol Riddell, which included a series of states, Colorado, Arizona, South Dakota, North Dakota, Montana, and Utah, and New York. There were core interventions that all of the sites were required to provide. It included assertive case management, benefits counseling, parent education and training, and paid and unpaid work experiences for youth. All of these interventions had some research or background that supported them making a difference, and so they were combined into this package. Work-based learning and benefits counseling, which is under the self-advocacy component of pre-employment transition services are now available through WIOA for youth with disabilities. With that, I'm going to turn it over to Carol Rudell. Thank you, Carol.
Thank you so much, Jade, and thank you, Christina, as well. Today we're just going to be speaking about one aspect, but it's a powerful aspect in the lives of people with disabilities, particularly youth and their families. Benefits counseling, or work incentives counseling, basically means I learn how these incentives are in place that I can move forward in my life, become employed, and more self-sufficient. But work incentives can be kind of confusing as well, because it does help to understand in terms of if I go to work, what happens to my income? What happens to this safety net of benefits that are in place for me? Let's begin by talking about what the benefits counseling intervention was within Promise. It was required, but why on earth would we require people to learn about their benefits? Well, there's research that's shown that when adults understand what's happening with their benefits, they're more likely to choose to become employed. By moving this into the younger sector, the youth that were in Promise, for example, we're helping them understand earlier, and we're also helping their families understand exactly what these benefits are and what it really means in terms of pursuing education and employment to live a life of self-sufficiency rather than dependency upon these many benefits. Of course, parents have to provide consent for anyone who's under 18, and they have to share a lot of information about themselves and their families. But this information is always confidential in the benefits counseling process. So let's talk a little bit about the history. We have a safety net that exists in our country, and it's been around for quite some time in terms of how do we care for those who are less fortunate in our society. These include Social Security, Medicare, Medicaid, SNAP, housing assistance. We have quite a few of them, but each of them have their own eligibility criteria. Eligibility in terms of how much earnings someone can have, as well as how much savings they can have, or resources as we call it. But this safety net can really become a trap. We have this fear of stepping forward when I know that this safety net's in place. I have confidence that I will have an apartment next month. I have confidence that I will have SNAP next month. So it's really difficult for folks to just take a chance for fear of losing something and thereby jeopardizing their family's welfare. But it's often an unknown fact that work incentives exist in all of these programs. And how do we share information with people so that they understand, yes, you can take that risk, you can take that chance, because we have incentives over here that will assist you in going to work or returning to work. In Promise, all of the youth who enrolled were already on SSI, or Supplemental Security Income. Now, SSI is always a means-based cash benefit, but it's often accompanied by Medicaid. Fear of losing health care is something I don't think any of us want to face. And can you imagine a parent of a child worried that somehow they're going to lose that Medicaid as well? For young adults to be on SSI, they have to have a disability, and it has to impact a life function. What do we mean by life function? That's basically things like eating, breathing, walking, talking, thinking. Basic human functions. So you have to also be in a household that is below 100% of poverty. That's pretty significant if you think in terms of I have a disability, it impairs a life function, and the household that I live within is below 100% of that federal poverty level. But the catch is then is now suddenly I'm probably eligible for a lot of other benefits as well. We've kind of created this web of all of these benefits I can be eligible for as a child that my family will benefit from, and I have a lot of rules to follow. So when Promise started, all of the youth who enrolled were at least age 14, but they had to be under the age of 18. So it's a pretty significant transition period of time. Families are starting to begin to think about what the future looks like. Students, young people are thinking about going to work, being like my friends. So it's an interesting time in terms of being able to look at all of these benefits that this family is receiving because this child has a disability. So what happens? We've got all these benefits, and families again start to become dependent upon that cash benefit, the health care benefits, the SNAP card, everything. It becomes this dependency, if you will. but fear of losing health care is by far the most fundamental motivation. Everyone I've ever worked with in the last 30 years of my career, if you say to them, what would you be willing to lose? The first thing they would never mention is health care. Everyone wants to have health care. But how can I overcome these consequences? I don't want to lose health care. I want to be sure I have an apartment next month. How do you mitigate the potential loss of the cash benefit of SSI and the benefits of health care or other benefits? And what's more complicating for us and Promise is everyone ages, right? It was basically a 6-year project. So we have 17-year-olds who are suddenly becoming 18 and 19. And what happens is now it's no longer just that childhood eligibility for Social Security or for SSI. It's now an adult eligibility for SSI. When we look at adults in terms of being eligible for SSI, the rules change a little bit. It's not just a matter of being under 100% of the federal poverty level, having a disability, and having an impairment to life function. Suddenly, employment becomes a key factor of being eligible for SSI as an adult. So let's talk about what SSI means in terms of being an adult, or even youth with disabilities. There are these work incentives. How can we find a way to help mitigate the loss of these benefits while also increasing income and greater self-sufficiency, not just for the youth, not just for the individual with a disability, but for their families as well? In Social Security itself, we have quite a few different work incentives, but the biggest one that we rarely think about, actually, is this idea of a 2-for-1 benefit offset. There's a threshold for earnings. If I'm receiving a check for, say, $700 from SSI, there's a point at which you think I'm going to earn money and it's going to creep up. Well, my check should go away. And that's really a myth in terms of SSI. What happens is if I receive a check for, say, $700 and I go to work and I start earning money, well, I'm getting $700, but gosh, I'm getting a paycheck for $400. I'm getting a check for $700 from SSI, and I'm still getting a check, and I'm getting a paycheck. The point at which that equals out, you would think the Social Security check would go away, but it doesn't. It actually offsets at a 2-for-1 ratio. So the point at which my earnings go up $2, my check only goes down $1. My earnings go up another $2, my check only goes down $1. So you can see what happens is as my earnings increase, I have a lot more cash in my pocket. I've got my check from SSI, I've got my earnings from my paycheck. That's a lot more money to have available to me. Now the catch is you're continuing to earn, but the check doesn't just disappear. It just offsets at a 2-for-1 ratio. For every $2 I earn above a certain point, my SSI check only goes down $1. It's a great opportunity. It's a great work incentive right there. I always tell students and adults as well, the reality is if you're on SSI, you'll always have more money in your pocket if you go to work. You have both the paycheck and the SSI check. And it really gives an opportunity for someone to get stable in their income and stable in their housing and allow them to proceed to earn more money for self-sufficiency. So for students, we also have another work incentive that's specific to individuals who are in school, whether that's K-12 high school, for example, or whether that's college or university work, technical training, vocational school. If a student is regularly attending any of those, they can have limited earnings that don't impact their SSI benefit at all. So for example, they can earn up to $1,900 a month or up to $7,670 a year. Now I'm going to make a caveat here. As we all know, these numbers change every year. And I'm always reluctant to say to people, well, you can earn $1,900 a month because you're going to remember that number for the next 30 years. The number changes every year, so it's important to remember that the numbers we're presenting today are really the 2020 numbers, okay? So a student in school can go to work. Maybe it's a work-study program at a college or a university. They can earn up to $7,670 a year before there is any impact on their SSI check. What a great opportunity to check out learning and not just test if I can go to work, but have the opportunity to truly earn money and decide what an opportunity this is to check things out, especially for kids in school. The reality is, how many of us kept that same job when we got out of school? If I've got training, I can try out different jobs. I have an opportunity to use that as an opportunity to explore careers as well. Some of the other incentives for SSI recipients include things like, do you have expenses related to your employment? For example, perhaps maybe you don't have a uniform for your job, but you do have a dress code. Perhaps it's all khakis and polo shirts or whatever. And there are expenses related to having a job. Sometimes it's just a matter of having steel-toed boots, right? Those can be expensive. What Social Security will do is they'll say, report to us how much you're spending on these employment-related work expenses. And in doing so, that amount of money is not counted when Social Security begins to count how much you're earning to see where you are in terms of eligibility for Social Security. So I can tell them I spent $100 on khakis and I spent $180 for steel-toed boots. And Social Security will say, okay, we're not going to count your whole paycheck that month. We're going to deduct those amounts from that. So it's a really great way to recognize that, yes, work can cost us money, but those expenses won't impact my Social Security check as well. Another incentive is called the PASS plan. This is a plan for achieving self-support. In terms of the things we plan for, if I'm working and I'm struggling with planning for and saving for advancing my career by going back to school, or perhaps I'm really struggling with transportation and I am not in a position to really save, say, to buy a used car, for example. Well, a plan for achieving self-support really works from the idea of I have a goal, but I need to be able to save from it. We know that all of these benefit programs have limitations on how much someone can save. What is the resource test for Social Security? And we know for an individual, that's basically $2,000 worth of savings. Might not get you very far in buying a car, especially in this day and age, but perhaps it can get you a used car and a good, stable car. But the reality is, how do I save for that without impacting other savings that I need? So the plan for achieving self-support allows you to set aside earnings. You have to be working. So it allows you to set aside earnings in a savings account that can be used for things like education or training. Maybe it's assistive technology. Maybe it's a car. Whatever it is. But you have to have a written plan that Social Security approves. So that plan will include a goal, how much you're going to save every month, because Social Security wants to be sure just because you're saving every month doesn't mean you're jeopardizing your own living and being able to care for your own health needs and your housing and et cetera. So the reality is you're going to save, but it shouldn't impact your ability to live, right? So you'll set aside savings from your working and achieve this goal. These plans are pretty detailed. Social Security reviews them. They have to be very specific in terms of the kinds of things they include and how you will be saving. But they do have to be approved by Social Security. It is a formal plan. As I said earlier, continuing health care is probably one of the most fundamental benefits that folks do not want to lose. They want to retain the ability to have their health care continue. So we have another work incentive called continuation of Medicaid. The number is actually 1619B. You'll hear it referred to that quite a bit, actually, 1619B. And the reason we have continuation of Medicaid is to mitigate that fear of loss of health care. So if someone has earnings and they keep going up, the point at which there's that equalization, they would typically lose their Medicaid, right? Because now their earnings are going above that limit. Well, what Medicaid says, or what the Social Security law says about Medicaid, is the person can continue to keep their Medicaid as their earnings go up. Even if their Social Security check goes down, they keep their Medicaid. You still have to be eligible in all other ways for Medicaid. So that means you still have to have a disability. You still have to have limited resources of $2,000. But the reality is you'll keep your Medicaid. And the beauty of that is someone can continue to work, have earnings. Maybe they're not working full time, but suddenly their earnings are above that limit for Medicaid. Well, they can keep their health care. They do, again, have to keep all other eligibility requirements. So the youth that participated in Promise, of course, as I said earlier, you know, they all kept aging. It's like, could we just keep them at 14 to 18? No, they keep aging. But at 18, it's a Very important time with Social Security. Children who are eligible for SSI, it looks at their household, their family's income, their family's benefits and everything. Once someone turns 18, it changes. Now the eligibility is solely based on that individual. Also at age 18, another criteria comes into play, and that's the ability to be employed, the ability to work and earn a certain amount of money. We call that substantial gainful activity. You'll hear it referred to as SGA. SGA meaning, can I earn this much money? If I can, I'm no longer eligible for SSI. But if I can't, I can continue to be eligible for SSI. Again, I have a disability. It's a medical model, so I have a disability, and my earnings are below $1,260. Again, that's 2020's dollar amount. It will change every year. But when a child becomes 18, they must be redetermined eligible for SSI. Again, it's based on their income, their household situation as an individual, as well as are they able to earn substantial gainful activity, $1,260 a month this year. Another interesting incentive that we have that is relatively unknown, and I encourage you to share this word as well. Section 301 allows a payments to continue for SSI so long as that individual is participating in some type of training or education program. They can continue receiving their SSI check so long as they have a plan that is working toward employment. So even things like vocational rehabilitation, maybe they have an IEP that includes vocational education with the schools. Perhaps they're using the Ticket to Work program under Social Security. Maybe they have a PASS plan. All of these different types of activities include a plan that is working toward the ultimate goal of becoming employed. So if someone has that type of plan in place, they can apply for Section 301 eligibility with Social Security and continue to receive their SSI check. Can't beat that. ABLE accounts. So ABLE accounts are not actually under the Social Security Act, but one of the biggest challenges we have when we think in terms of savings, and I've mentioned it a couple times, is with Social Security, an individual has a $2,000 asset limit, or in a couple it might be $3,000 asset limit. That really becomes difficult to save for a future. When we think in terms of becoming stable in our income and in our lives, it usually includes things like owning a home, even a small home, but building an asset in a way that allows us to truly become financially and fiscally stable in our lives. A $2,000 cash limit doesn't really allow a person to move forward in that way. ABLE accounts can help you do that. It's achieving a better life experience, otherwise known as ABLE. They are tax advantage savings accounts for individuals with disabilities. Now, the individual has to be eligible based on when that disability occurred. So right now, under the law, the age of onset of disability must be prior to turning 26 years of age. There's discussion about raising that number, but for the time being, that's where Congress has established it. So if someone has a disability prior to age 26, they could very well be eligible for an ABLE account. So when we think about SSI, Medicaid, SNAP, housing, all of them have that resource test, and that restricts their eligibility for savings. But ABLE accounts give them an opportunity to actually remain eligible for those public benefits and save. There are many costs associated with having a disability. Now, sometimes that's certainly more than just a copay, right, for healthcare. Maybe it's a matter of keeping on top of accessible transportation has a cost to it. The technology, if someone is using a tablet, for example, for communication, the tablet dies or gets broken, suddenly I've got this expense on top of it. And these expenses can really become detrimental to someone's budget every month. If suddenly I have to replace a $300 tablet, how do I find the money for that? Well, being able to save into an ABLE account allows you to use the ABLE account savings for these disability expenses. In fact, that's all the money can be used for. If you're putting away a little bit of money every month into an ABLE account, you need to be able to use it for disability-related expenses. And the other beautiful thing about that is anyone can make a deposit to an ABLE account. You have grandparents or family members that are giving you money for graduation or whatever, you can actually put that money into an ABLE account and be able to save it for expenses that are related to your disability. Now, they are not impacting SSI, Medicaid, SNAP. All of those programs will actually exempt the ABLE account when they're counting resources. So let's say I've got $1,000 in my savings account that I've managed to save, my regular savings account, but now I've got $1,500 in my ABLE account. And under normal circumstances, Social Security would say, wait a minute, you got $2,500 there. You need to reduce that $500 extra in that ABLE account. Well, the ABLE account isn't counted. When Social Security starts looking at resources, the ABLE account is excluded. It is not counted. They'll only look at that original savings account, which is great. It allows people to save for those expenses that come around because they have a disability. You can learn more at the ABLE National Resource Center. That is ablenrc.org. A lot of great information there in terms of how to enroll. We have 47 states right now that allow an ABLE account. And the beauty of it is Social Security isn't going to look at that ABLE account until there's $100,000 in it. And some states have even said, we're not going to tax it for state purposes if it's up to like $475,000. So the reality is it's a great opportunity. It's tax advantaged. It's a way for individuals to save for disability expenses without it impacting their other safety net items or their other eligibility, certainly for Social Security. Wow, is that complicated enough? It is. I won't kid you there. There's a lot of rules about every one of the safety net programs. There's a lot of rules around Medicaid and Social Security. It's just very, very complicated. And unfortunately, it can be so confusing that individuals just freeze. They won't take that risk or that chance in order to become more independent, employed, because of their concern around messing up this complicated net that I'm now participating in. But the interesting things is there's more to it than that, and there's an expectation for young people among their peers. If everybody else has got a job, there's an expectation that they have a job. Now contrast that with a family that's saying, whoa, wait, don't go to work. We don't want to mess up having this SSI check. I mean, if it's helping to pay for the apartment or the roof over the head, the family isn't going to want the student to go to work because the risk of impacting the rest of the family. So there's a lot of misinformation out there, a lot of myths around these safety nets, and they really just cause people to fear and to freeze in terms of moving forward. But we have a solution to that, and that's what this whole session has been about, and that would be benefits counseling. Social Security has funded a network nationally of what we call benefits experts, or benefits counselors. These are individuals who totally understand all of these programs and all of the work incentives that are entailed. And as a consequence, they're in a position to assist people in learning about their benefits, understanding their benefits, and making more informed choices about how they're going to use those benefits or those work incentives to move forward to greater self-sufficiency. So the Work Incentive Planning and Assistance, we call that WIPA. Work Incentive Planning and Assistance, again, is a federally funded program, although many states also supplement it. It's free. We have community work incentive coordinators. They provide in-depth counseling that's individualized about earning money, going to work, making savings, how you make plans around work, and how it affects all those benefits. They are experts in both federal and state work incentives and other resources in their communities. They provide information and training around their states about work incentives. They also will analyze and explain public benefits at the individual level, as well as at a more global level. Like today, I've just shared general information, but for an individual young person, individual with a disability, or their families that want information about how it affects them specifically, that's exactly what that community work incentive coordinator will do. There's also lots of paperwork. Remember we mentioned with employment-related work expenses. You've got to tell Social Security that you've spent money on the khakis and on the steel-toed boots. You've got to tell Social Security you want to plan, if you want to plan for achieving self-sufficiency, the PASS plan. Lots of paperwork involved with all of these types of things. And the Community Work Incentive Coordinator can actually assist with that paperwork as well. So I encourage you to contact the WIPA provider near you. We have created a spreadsheet of all of the ones across the country and how to contact them. They don't change very often, but sometimes they do. But you can find out more just by asking your vocational rehabilitation program, for example, who's the WIPA in our state? And I'm sure they'll have the name and contact information. Again, this isn't just for young people. The WIPA program, Benefits Counseling, is available to anyone who's receiving SSI, SSDI, any type of disability-related Social Security. Chances are, if the individual's involved with vocational rehabilitation, I know the VR counselors will be sharing that information and encouraging people to meet with a benefits specialist, a benefits counselor, just because it benefits vocational rehabilitation. Actually, it benefits all of these public benefit programs if someone understands about their benefits and they can make a better informed choice. If they can make that informed choice, then chances are they're going to go to work. If they realize that going to work and having earnings is not going to impact their health care, their SNAP, or whatever, they're more likely to choose to go to work. You know, I've been working in the disability arena for over 30 years, and I've yet to tell somebody they don't want to go to work. 9 times out of 10, it's, I want to go to work, but I'm afraid to. And so how do we help them overcome that fear, overcome the feeling of being trapped by all these benefits, and help them make decisions to move forward? Benefits counseling can really help folks do that. Oh, also, benefits counseling is available in terms of pre-ETS, pre-employment transition services, which is available to youth. This is a program that's offered through vocational rehabilitation. So if young people are involved with vocational rehabilitation, they're probably involved in the pre-ETS program, trying to learn more about going to work. And you know what, Jade, I think it's time to turn it over to you to talk about this toolkit that's been created. We have learned a lot in Promise and a lot of different opportunities, as well as planning, handouts, materials that really can help us move forward. So I'll let you take the time, Jade.
Great. Thank you so very much, Carol. So talking about the toolkit, and one of the things that we learned was what we communicate and how we communicate with families and youth is critically important. So one of the tools that we've developed is a template for a document that makes the case to families about how youth can work and includes a place where you can put the location of your WIPA or your vocational rehabilitation so that it helps your frontline staff in terms of communicating and messaging what this complicated service is. And so that is a tool that you can modify for your state and disseminate it through schools, through your partners. There are also a series of fact sheets that break down each of the different work incentives, student earned income exclusion, and others. And they're available on the website if you're interested in trying to understand what each of the different work incentives are. At a minimum, it helps you to see the wide array of different work incentives that exist out there to really reinforce the fact that there are a lot of different ways to be able to return to work and benefit and retain those important benefits. There are also resources on where to get more information and training. And finally, we have questions to stimulate state and local discussions. It's really important to start to examine what our thoughts are about benefits and work and people with disabilities. What does economic self-sufficiency mean? Is merely having SSI making an individual economically self-sufficient? Or are there other steps that we need to take if we're truly to put the populations that we serve on a path to long-term economic self-sufficiency, particularly for youth who face a lifetime of poverty if we're not intervening early to help them to understand that there are different choices available to them. These resources are available at www.mdtransitions.org.
Finally, I want to express my appreciation to Carol Rudell, as well as the APHSA and Conference Edge staff, and we hope that these resources help you and your teams to improve the economic self-sufficiency for the youth and families that you serve. Thank you.